most common diagnosis of mesothelioma is high up in the differential. And generally, if you look at malignancy diagnosis from closed pleural biopsy, literature will say 30 to 50% yield, and in thoracoscopy it goes up to 95%. Whereas when TB is suspected, the yield with closed pleural biopsy is stated to be 60 to 80%, and a slight increase to 90% plus with thoracoscopy. So were you able to justify doing an invasive procedure thoracoscopy when you have high incidence of TB? That was my question.
It is certainly justified to me in our local setting because I believe that our technique of closed pleural biopsy is not good, and then because it is a blind procedure. But I personally feel that fluoroscopy is a minimally invasive procedure in our place, and it is certainly justified based on the data that the cases of malignancy and tuberculosis are almost equal. So we would like to avoid empirical TB treatment. We no longer do closed pleural biopsy nowadays. Yeah.
I think that's an excellent question, Dr. Bernard. Would you please, audience, raise your hand. How many of you do closed pleural biopsy in your practice? I would say less than 25% of the individuals now do closed pleural biopsy. And I don't think in the United States anybody does closed pleural biopsy for the reasons you mentioned, that TB prevalence is so low that doing that diagnostic yield is very low, and hence people directly go to fluoroscopy. So is that the reason? But your argument is that because TB is so prevalent, you would do closed pleural biopsy.
Yeah, I mean in our setting in UK, closed pleural biopsy needle is in the museum now, so we've not used it for many years. But there's a paper from South Africa, Diacom and Chris Walker, their team, showing that in TB, 75% yield, and therefore they tried to do closed pleural biopsy, but that was the discussion.
I have a question for you. How many pleural taps you do before you go for fluoroscopy? How many negative pleural taps you have here? 1 or 2 or none?
How many pleural taps we do before fluoroscopy?
Yes.
We do on all patients routinely.
Yes. Yeah. How many? 1 or 2?
1 or 2 times, you mean?
Yes.
Oh, okay. Most of the time, only once.
Okay. Yeah. All right. How many of you do 2 pleural taps before you go for fluoroscopy? How many of you directly go to fluoroscopy? I recently read a paper, which was just not published yet for consideration publication, where they directly went to fluoroscopy without doing even a single pleural tap. So I think that is an overuse of the procedure which is available. At least one